Your life will burn out, but you can save another by donating your organs. Shamlal is 60 years old. His liver failed due to alcohol. Vikram is 28. He consumed rat poison, destroying his liver. Munir is blind since childhood and yet to see the light at the end of the tunnel. Sukhram's kidneys have failed due to jaundice. All these patients have no option but to wait.
The hope for survival of such patients is in transplanting the liver.
Now what he needs is renal transplant.
With India far behind in the field of cadaver transplants, there are more than 1.5 lakh people who are suffering from organ malfunction. It is unbearable to see their pain as they wait and hope. Hope for a life, for a death.
Is a cessation of life. It is the irreversible disintegration or cessation of all functions of the human body. And for this, a prerequisite is death of the brain. The criteria are two types. One, the age-old cardiorespiratory criteria of death, and the second, neurological death or brain death.
Death is a mystery, a lesson we will never learn. Past history has shown us that people once declared dead have come back to life. With the developing technology, science has redefined death. Brain death or coma de passe is one of the accepted norms of the world. First reported in 1959 by a French neuroscientist, it was described as the syndrome of death of the nervous system. Maharashtra was one of the first states to adopt to the criterion. 5 years since the first cadaver transplant was done in San Hospital, the progress has not been very encouraging. Due to lack of awareness and religious sentiments, the Indian mind is yet to be convinced about brain death and its ability to save human life.
The brain consists of a few parts. The large part is the covering on top, where you have what's called the cerebral cortex. The cerebral cortex itself is responsible for the content of thought. Now below that, in the lower portion from here down, we have the brain stem, which consists of three parts. First you have the midbrain, then the pons and the medulla. And all the pathways, I should say, of the brain from the cortex to the different parts of the body, the different organs of the body, comes through the brain stem. This is a model of the brain. I had told you earlier that we have what's called the cerebral cortex. If I turn it around the other side, we have the brain stem. The midbrain, the pons and the medulla. In these minute structures as compared to the cortex, we have certain pathways called the reticular activating system, which is responsible for consciousness. So the content of consciousness resides in the cortex here, and the concept or the potential for consciousness is preserved over here. This is really essential for life. If you don't have that, you cannot have any consciousness, and that is the end. In modern times, the three organs that are required for life, namely the heart, the lungs and the brain has to be alive, has to be functioning. And if that is so, the person is not dead. And science has so advanced that we have machines which can allow a person to breathe, allow a heart to beat, and yet the brain can be dead.
A person who dies on the roadside or one who dies at home is not an eligible candidate for organ donation, because for brainstem death to be certified, the patient has to be admitted in an intensive care setup on a ventilator so that all his organs are well perfused with oxygenated blood. And the person should be deeply comatose, and we should know what is the cause of his coma. Unless we know the cause and treat that causative factor for the coma, we cannot declare a person as brainstem dead. And there are certain conditions like very low temperature, that is hypothermia, where the patient's temperature is less than 35 degrees centigrade. Or there are certain patients who are on certain drugs like hypnotics and barbiturates, which make the patient deeply comatose. Such patients, unless they come out of this condition, like unless they come out of the effect of drugs or their temperature is brought up to normal, till then we cannot certify that particular person as a brainstem dead patient. This is a case of a head injury patient following a railway accident. He has an extensive cerebral intracranial injuries. Probably he is brain dead. So I am going to show you tests how to confirm, diagnose and confirm brainstem death. The most important thing is to look for pupillary reaction to light. When I shine a torch on his pupils are not reacting, both his pupils are not reacting to light. There is no doll's eye movement. On shaking the head, the eyeballs are not moving. When I do an endotracheal suction, this is probably the first indication that this patient is brainstem dead. So I am doing an endotracheal suction and the patient is not bucking or making any attempts to cough. This patient is deeply unconscious. On deep painful stimulation, there is no grimacing of the face or movement of any part of his body. These are the certain tests which are done to confirm brainstem death, and there is a specific test called the apnea test which is done to confirm. It is an objective confirmation of brainstem death. We pre-oxygenate the patient through the ventilator. Then we disconnect. Before disconnecting, we collect a sample of blood to see the arterial blood gases. Then we disconnect the ventilator and introduce oxygen through a catheter so that he gets enough oxygen, and we watch for any respiratory attempts. There is no respiratory attempt. We wait for 8 to 10 minutes. If there is no respiratory attempt, we collect another sample of blood and then reconnect the ventilator, and then we look at the arterial blood gases report and confirm that the tension of carbon dioxide in the blood has risen to 60 millimeters of mercury, and even with such a high carbon dioxide tension in the blood, his brain stems are not stimulated, so he is not making any attempts to breathe. So that is what confirms that he is brainstem dead. And such a certification is done between an interval of at least 6 hours. So first, if you have done it now, after 6 hours again it is repeated by a set of 4 doctors. First doctor is the person who is treating the patient, and there is one consultant who comes independently, confirms all these tests, and the third is a neurosurgeon or a neurophysician, and the fourth person is the head of the institution, like in our place the dean of the hospital. So all these 4 people independently confirm that this particular person is brainstem dead once, then 6 hours later once more, so that there is no element of any doubt in anybody. Maintenance of such a cadaver is a complicated challenge. We maintain his heart and lungs artificially through this ventilator. The lung is well ventilated and the heart is well perfused with this intravenous fluid which contains the drugs, dopamine, which maintains the heartbeat, keeps the blood pressure at a normal level. You can see his urine output is good with all these. In spite of the brainstem not functioning, you can see the kidney is functioning, his heart is being maintained, his lungs are being perfused with oxygen. So all his organs are basically still living with well perfused oxygenated blood. All those patients who are brainstem dead cannot be, they are not eligible for organ donation. Like there are certain fixed criteria, like the person has to be between the age group of 3 to 65 years, should not be suffering from any major kidney or liver problems or lung problems, should not be harboring any viral or bacterial infection, should not be suffering from AIDS, should not be suffering from cancer of any part of the body except the brain and treated skin cancers, or should not be suffering from diabetes mellitus or hypertension. So all these, after ruling out all these screening criteria, then an eligible candidate is selected for organ donation. The various organs that could be retrieved from a donor are liver, kidneys, pancreas, lungs and heart.
Once brain death is confirmed by the doctors, the next step is to retrieve the organs for the transplantation. And this can be done only after doctors get the requisite permission from the family. As this process goes on, the patients on the waiting list are called in to find a perfect match for the transplant.
Patients with chronic renal failure have only two treatment options. Either they can go on a dialysis or they can go for the transplant program. Now, dialysis has its own inherent problem that the patient has to visit a dialysis center at least 2 to 3 times a week. He will be hooked on dialysis machine for about 4 hours to 5 hours a day whenever he goes. His kidney being failed does not produce a substance called erythropoietin, which is needed for blood formation, and hence he requires repeated blood transfusions, and with the fear of contacting all contactable disease like AIDS and hepatitis. The disadvantage is that it is a costly affair. Around transplant period it takes about 50 to 60,000 rupees, and after that there is a lifelong immunosuppression which cost about 5,000 to 6,000 rupees on an average.
Prior to the transplant, the recipient has to undergo various investigations which include detailed history, physical examination, blood investigations, assessment of heart and other systemic functions, psychological assessment, screening and treating bacterial, viral diseases, controlling the hypertension and treating anemia, and finally his HLA typing for matching the kidney.
Ramesh Patel, whose kidneys have failed since 1993, is one of the lucky few to have his body match a cadaver donor.
Yeah,
Ramesh has been brought in for a kidney transplant surgery. He is being prepared by giving anesthesia so that he does not perceive the pain, and his vital parameters are stabilized and maintained. He is now cleaned, painted, draped for the operation. Prior to this, the kidney is retrieved from the cadaver. It is then placed in a ringer lactate ice tray and perfused with chilled preservative solution. The kidney is now ready for transplantation. After the bed is prepared for the kidney, usually in the right lower abdomen, the donor vessels are anastomosed with recipient vessels, and the ureter is reimplanted, thereby giving Ramesh a new lease of life.
The results are very encouraging. Survival rate after the cadaver transplant is 80%. Is the cadaver transplant very expensive? In a government hospital it would cost 1 lakh rupees, and in a private hospital it would cost about 4 lakh rupees. though the treatment and the results are the same.
Post-transplant, patient remains in an isolation room because he is on a heavy immunosuppression to prevent rejection of this kidney. He is intensively monitored, and around 10th day all his tubes are out, and after that we start him rehabilitating, and around 15th day probably we remove all the suture and explain the patient his altered way of life.
मी प्रेग्नंट होती त्यावेळेला डिलेवरी माझी लवकर झाली. त्याच्यामध्ये मला समजलं की माझी किडनी फेल आहे. त्याच्यानंतर डायलिसिसचे चालू असताना मी 2 वेळा खूप सिरियस झाले. सिरियस झाल्याच्या नंतर त्यांनी मला पेढीला ठेवलेलं. 48 तासाची मुदत दिलेली मला.
जुलाब हो रहा था, उसके बाद में भयंकर था, तो मैं बोला पानी की वजह से कुछ प्रॉब्लम होगा. तो डॉक्टर को चेक कराया तो डॉक्टर ने अर्किसन हॉस्पिटल में मेरे को बताया कि तुम्हारे दोनों किडनी फेल है. इसके बाद उसने बोला कि तुम किस्सुला करो और तुम डायलिसिस चालू कर दो.
अवस्था माझी बघून म्हणजे घरचे पण हेच असायचे ना, निराशेच असायचे ना. काय म्हणजे आई वडील झाले, भाऊ बहीण झाले, म्हणजे ती माझी परिस्थिती त्यांना बघवत नसायची. मला जसं श्वास घ्यायला त्रास व्हायचा, म्हणजे मला श्वास पूर्ण असा घेताच येत नव्हता. वरचा श्वास वरती, खालचा श्वास असं, म्हणजे माझी चालता येत नव्हतं, उठता येत नव्हतं, बसता येत नव्हतं. असे दोन्ही साईडनी म्हणजे मला धरायला लागायचे. त्या टायमाला मी कुठे उभी राहायची.
क्योंकि मैं यहाँ आ गए तो मेरे साथ में मेरा औरत भी साथ में रहे और बच्चे लोग घर में अकेले रहे. बच्चे लोग स्कूल में पढ़ने जा रहे हैं, उसके लिए खाने पीने का प्रॉब्लम होता है, स्कूल जाने के लिए तैयार होने के लिए. तो सुबह में मैं डायलिसिस को निकल जाता था तो उनको बहुत तकलीफ होती थी.
आणि 16 तारखेला असं कळलं की असं डोनर आहे म्हणून, की तुम्ही या. आम्हाला फोन आला घरी की तुम्ही या म्हणून. तर मग आम्ही तेव्हाच गेलो. मग आमची काही थोडीशी माझी टेस्ट केली आणि त्याच्यानंतर लगेचच मला पहाटे 4ला ऑपरेशनला घेतलं.
पहले जैसा नॉर्मल मैं हो गया हूँ. मैं कहीं भी जा सकता हूँ, आ सकता हूँ अकेला. और खाने पीने में तो परहेजी है लेकिन खा सकता हूँ.
4 वर्ष झालेली आहेत आणि ते सक्सेस झालेले आहे माझे. आता म्हणजे
दिया जो जिसने वो हिसाब से मेरे को अच्छा, उसके लिए मैं शुक्र मानता हूँ.
नवीनच म्हणजे मला जीवन हे झाल्यासारखं वाटतं ना. आणि खूप मी म्हणजे सगळ्यांबरोबर हसू खेळू शकते. त्या टायमाला तर मी काहीच करू शकत नव्हते. आता सर्वफार म्हणजे खाऊ वगैरे शकते. जसं माझं झालं तसं मला असं वाटतं की माझ्यासारखं अजून सर्वांना म्हणजे व्हावं ऑपरेशन, माझ्यासारखं जीवन जगावं त्यांनी, असं तरी म्हणजे मला खूप वाटतं.
As Ramesh, Vishakha and a few others breathe a new life, one should not forget the importance of the family who have shown courage even in time of grief to make the decision to donate the organs.
And during the funeral we did a tribute to her where we told people that she had gone ahead and donated her organs, where she helped a lot many people. And we as a family, we decided to pledge our organs on that day after our death.
मुझे पहले दिन ही मालूम पड़ गया था कि मेरा लड़का अभी बचने वाला है नहीं, इसलिए मैंने भगवान के ऊपर ही छोड़ दिया था और सोचा कि भगवान जो करते वो सही करते हैं. आज नहीं तो कल तो वो जाने वाला है. तो अभी जाते जाते भी उसका कुछ भी उसका काम आ जाएगा किसी को, तो मैं यही समझूंगी कि मेरा लड़का ही वापस मेरे पास ही है. क्योंकि वो खाली उसका शरीर ही जाता है लेकिन उसका आत्मा तो मेरे पास ही रह गया है. तो इधर सब लोग हम लोगों ने बताया कि हमारा दोनों का यही लास्ट निर्णय है कि भाई श्रीपाल को डॉक्टर के पास छोड़ दे देते हैं और उसका जो भी काम आएगा ना वो सब देने का है.
The cadaver transplant not only saves 7 human lives but also puts a stop to organ trafficking, which was rampant until lately. This is the first transplant in March 1997. There have been little over 200 cadaver transplants. The government and the doctors have done little to increase the number.
The Maharashtra was the first state to implement the act and design the rules which were framed with the help of the experts from some of the teaching hospitals. Brainstem death has been clearly defined in the act and rules, and we have constituted the expert committees in the institutions which have been declared by us, who are supposed to be, who are empowered by the state appropriate authority to conduct the surgeries. Only when the committee is satisfied then the person or that particular cadaver is the kidney transplant or any other organ transplant can take place. Every case which is unrelated donor is interviewed by us, in spite of the fact that if we don't permit, the patients are going to die because they will not get kidneys in time, but we try and ensure that there is no illegal trafficking taking place.
We are going to ensure that all persons in need of organ transplants, they can register with our center. It will be computerized, and also the availability of organs will simultaneously be computerized. They will be matched so that people will get the organs they want, and in a manner that is very transparent. We hope that when this catches on, that it is properly implemented. Our center, it put an end to the trafficking and sale of organs from live donors.
Today, the Zonal Transplant Center at Lokmanya Tilak Hospital is giving the transplant program much needed boost. One can look forward to well-coordinated facility that will bring together all the hospitals to one goal: organ donations and transplants. With the support of the hospitals and the government, the common man can hope to see the setting of another beautiful day and look forward to a better, brighter tomorrow.